me in week 4.
This meeting is being recorded.
Sorry, before all of those notifications, did someone say something?
I was just asking if we're in week 4.
We are in week 4, yeah. Yes. All week long. I'm here for it. All right, my friends, we are getting started with week 4. We are covering muscles of the medial thigh. And these muscles are going to all belong to the adductor group. So we are looking at the adductor group. This is a new group, right? We had the quads on the front. We've had hamstrings on the back. Now we're looking at the medial aspect, the adductors. First things first, though, there is a site of caution that we need to be aware of now that we're working on the anterior and the medial thigh. And this site of caution is called the femoral triangle. So the femoral triangle is bordered on 3 sides by a ligament and 2 muscles. Those are the inguinal ligament. And the easiest place, guys, the easiest place if you're trying to like picture that, it's what makes the V. You know that hip, the V on your hips, that's the inguinal ligament. So you got the inguinal ligament, the sartorius muscle, which we were introduced to last week, as well as the adductor longus muscle. And the structures are listed here on the PowerPoint, right? Femoral nerve artery vein, lymph nodes, and the great saphenous vein. I have taken the liberty of pulling this guy up and making sure that all the important structures are in here, just so we could get a little bit of a closer look as to what's going on in here. So it should give me the ability to restore. Boom. So here is our right hip. You're looking at the front right hip. Right here in green, there is our inguinal ligament. So there's the superior border of this femoral triangle. Here is sartorius, making the more lateral border. And finally, nope, there it is, adductor longus, creating the more medial edge of this triangle. Now, as with all endangerment sites, the reason it's an endangerment site is because all of these delicate structures rise up really, really close to the surface. So if we're putting a whole lot of pressure on this area, if we're digging in with certain kinds of massage tools like fingertips or an elbow, we want to be really, really careful when we're working in this area. The reason is because first of all, we have the femoral artery. It's a huge artery carrying fresh oxygenated blood to all the muscles and bones of the entire leg and foot. So yeah, we really don't want to be cutting off blood supply to the entire leg. And you can do that really well right there at the femoral artery. The next major structure is, it's listed here, the femoral vein. The femoral vein. So this is again going to be the major avenue that blood is being returned from the leg back up to the upper body and up to the heart. We also have inguinal lymph nodes passing lymph from the lower leg on back up to the rest of the body. But also we have the femoral nerve. So most of the muscles that sit on the front or medial side of the leg are going to get innervated by a nerve branching off of this. If we are a muscle on the posterior side of the leg, our nerves are probably going to branch off of the sciatic nerve, right? So the sciatic nerve is mainly for the back of the leg. The femoral nerve is for the medial and anterior leg generally. So we can imagine why this is very important, and we are very cautious about this guy as well. But wait, there's more. I'm going to zoom us out and I'm going to clear a whole bunch of these materials out because I want to pull your attention to something very important. And that is another vein, not the femoral vein, but this time we are looking there. This entire vein branch, which ends in the hip, way up in the hip near the acetabulum, but it originates all the way down in the ankle. This is the longest vein of the body, the great saphenous vein. The great saphenous vein. You'll see the name up there in the top corner of the app. The great saphenous vein, the longest vein in the body, not the widest, right? Not the widest, the longest. So the reason that we paid close attention is because all of these structures rise very close to the surface. We want to be very careful when we're working in this area. You don't want to put too much pressure on a nerve or an artery. I mean, or a vein or a lymph node, but you know what I mean. It's really the vein and the nerve and the artery that are the most pressing concerns in this femoral triangle, the femoral triangle. Cool, good stuff, feeling good. Moving on. Major muscles this week are the adductors. And the way we are going to remember the names of our adductor muscles is through this very lovely mnemonic, please bring me lunch, girl. Please bring me lunch, girl. So all of these 5 muscles belong to the adductor group. So I'm going to call them the ads. They're the adductors. But only a few of these muscles actually get the name adductor. Okay? So there are extra muscles that don't have the word adductor in their name, but they do belong to this group. So here we go. Starting at the top, we have pectineus, adductor brevis, brevis tells me it's the short one. I have adductor magnus, and very much like gluteus maximus, the magnus is the largest one in the group. Anywhere you see a brevis, there is going to be a longus. Those names always go together, just like major and minor. If there's a pec major, there's a pec minor. So if there's a longus, there's a brevis. And last we have gracilis. So 3 muscles in this group get the name adductor. They are magnus, longus, and brevis. The next 2, we have pectineus and gracilis. Please bring me lunch, girl. So all of the adductor muscles, since they, adduct, they will all insert on the medial aspect of the thigh. These are all going to be medial muscles. They will originate along the pubic bone or the ischium, and they drape along the medial thigh very much like a curtain, draping down and inserting all along the shaft of the femur. It's very important that we notice one more detail about these muscles. No muscle in the adductor group crosses the knee, which means the adductors only adduct the hip. They do not have anything to do with knee movement. If we look at the most distal muscle here, you'll see adductor magnus inserts on the medial condyle of the femur, not the tibia. So it doesn't cross the knee. These muscles only move the hip. Capiche? Capiche. All right. So in situ, we have all the rest of the muscles fleshed out. You'll see, for the most part, the adductor muscles are covered by the quadriceps. Quadriceps are the more superficial, therefore the easiest to see, and they will be the easiest to palpate. You're going to have to palpate through the quadriceps in order to start feeling the adductor muscles. So starting with the largest, seems the logical place to begin, we begin our journey with adductor magnus. Now the name tells you something. Magnus means it's massive, it's big. This is the largest of the adductor muscles. Adductor magnus originates on the inferior ramus of the pubis, the ramus of the ischium, and the ischial tuberosity. Ding, ding. Where have I heard that name before? Ischial tuberosity. Why was that important? Oh, racking my brain. What was it? I feel like there was another important group of muscles that maybe also attached to the ischial
Hamstrings.
tuberosity. Hamstrings. So if the hamstrings all start there and this muscle starts there, guess what those muscles have in common? Not just the origin, but the action. This is going to be a, what's the word I want to use? An honorary hamstring, right? It's inducted into the group of hamstrings. Because the adductor magnus originates on the ischial tuberosity, it will also assist with hip extension, just like the hamstrings. So extending that hip is an action of adductor magnus as well. Insertion. This muscle will insert along the medial lip of the linea aspera. If we don't exactly remember where that is, that's okay. I'm going to show you. Looking at the thigh, we turn to the posterior side. We'll remember there are two distinct ridges that run down the posterior shaft. Those are the medial and lateral lips of the linea aspera. I'll highlight those two bony landmarks for you. There. So the two are colored the same right there on that little pink line. But if you look below that pink line, do you see this red and this orange, those two lines that are coming up to join? It's the same line. It's the same line. The color is weird. I know. We get over it. Those two lines come up, they run right next to each other, all the way up the femur, medial lip, lateral lip. So adductor magnus, we'll start adding in some deeper muscles. There is adductor magnus, and holy cow, what a magnificent muscle. Boom. Pubic ischium, ischium of the ramus, tuberosity of the ischium, medial lip of the linea aspera, and finally it inserts on the superior aspect of the medial condyle of the femur. Specifically, there's a little tiny bump that sits there. It's called the adductor tubercle. The adductor tubercle. That is another one of its insertion points. Now, one more little note that I want to point out. This app might look really weird when you look at the line of that muscle. You see all those little divots that are cut out of it, right? All those little loops that are taken out. You might say, oh, what a weird app. It just like carves those things out. No, those are really there. Those are real things. And the reason is that they create places for other stuff to pass through, like blood vessels and nerves. So just because there's a curtain of muscle doesn't mean stuff doesn't need to get through that curtain. So we're going to create distinct little holes just to make sure they've got a little inlet that they can pass through and get to the other side. So adductor magnus, there we go. Looking at this muscle, taking a look at where this muscle inserts. Because it's touching the front side of the pubic bone, it will assist with hip flexion. It will assist with hip flexion. But we know also, because of that other origin, on the ischial tuberosity, it assists with hip extension as well. So it flexes and extends the hip. What does that mean, guys? What does it mean when a muscle can do two opposite actions? Something
It's an
important.
antagonist.
It is an antagonist to itself, which is pretty fancy and pretty rare. So when it happens, we all want to take a moment and ooh and ah about it. It flexes, it extends. Furthermore, because its insertion is on the medial lip of the linea aspera, it's an adductor. We could have inferred that by the name. But there, those are its actions. Flexion, extension, adduction. Because of that ischial tuberosity origin and that adductor tubercle insertion, when the muscle shortens, it can also create medial rotation. Just pulling the middle of the knee backwards towards the back of the hip. That's going to create a medial rotation. So we have 3 distinct origins, 2 distinct insertions, and 4 actions. Luckily, 3 of those actions we can infer, right? We can start taking good guesses by looking at where that muscle sits. It's the medial rotation that you might have to just memorize. So we'll take a peek at this muscle in motion. We'll start with hip flexion. Woo, reset, computer, reset. There we go. So as the muscle shortens, it is pulling the knee towards the hip. We also have hip adduction. And finally, hip extension. All right. Adductor magnus. Good stuff? Good stuff. All right, so there's a quick illustration of adductor magnus. Next, we move on to adductor brevis. This will be the short one, the short one. Adductor brevis originates on the inferior ramus of the pubis, inserts on the pectineal line of the femur, and along the medial lip of the linea aspera. So since it starts on the pubis, that's on the front side. So starting on the front of the hip tells me flexion. Being in the adductor group tells me adductor. And since it starts on the medial lip of the linea aspera, when it pulls that hip, it's going to pull the thigh into a medial rotation. So we've got medial rotation number 3. Zooming in. This muscle right here in front is the adductor longus. I'm looking for adductor brevis right behind it. Isolate this muscle from the pubic bone to the medial lip of the linea aspera, as well as the pectineal line, which doesn't show up on this app. Sorry. The only actions that this app shows us are the flexion and adduction. It does not show us medial rotation. But just like the adductor brevis, or I'm sorry, adductor magnus. And so just like all the other muscles, guys, we start by bringing the leg into abduction, which will lengthen the fibers of this muscle. Once the muscle is lengthened, then it shortens and brings the leg back into adduction. All right, so adductor brevis is the short one. We can see there's where it's sitting. Next, we look at its cousin, the adductor longus, the long one. Adductor longus will begin at the pubic tubercle. So slightly different spot on the pubic bone, not the flat ramus, but the little bump, the little tubercle. Inserts medial lip of the linea aspera. You guys should be sensing a theme here. Actions. So this muscle, just like the others, it starts on the pubic bone, it ends at the linea aspera. So it's doing these same kinds of actions, right? Flexion, medial rotation, adduction. The only muscle so far that has gotten anything different has been adductor magnus, which can extend. It's the only one that gets to do something fancy. Right? Welcome to the joys of being Batman. Job has its perks. So adductor longus. Zooming in, that muscle that's lit up back there, that's adductor brevis. This guy is adductor longus. Come on, okay. My app is being real slow. Sorry. There we go. Adductor longus. So starting at the pubic tubercle, notice that's a little bit more anterior than the ramus, where the other guys were starting. This muscle will come down and insert again at the medial lip of the linea aspera. And just like its buddies, flexion, medial rotation, adduction. That's what these muscles do. It's a cutesy little illustration of this muscle. And now we move on to muscle number 4 in the group. This is pectineus. So the pectineus runs from the superior ramus of the pubis right up along its upper margin, and it inserts on the pectineal line of the femur. This is in fact what the pectineal line of the femur is named for, as being the insertion of the pectineus. Since it's an adductor, notice same actions as all the others: adduction, flexion, medial rotation. Only one that's different so far is still adductor magnus. So the pectineus is the one, if you look at the pubic bone, it's the one that looks like it's draped over it right here. Starting up at the superior margin, it drapes over the anterior aspect and inserts onto the femur. When we isolate the femur, you'll see, and again, guys, I know it feels like we're splitting hairs here. Welcome to anatomy. This is the world we live in. But that medial lip of the linea aspera just keeps going up. At a certain point, we are the ones that change the name to pectineal line. The femur does not give a shit what we call it. It's the same ridge that runs along the bone. We are the ones that just decide, okay, this part we call medial lip of the linea aspera. This part we're calling the pectineal line. We changed the name because that part of the pectineal line, or that part of the linea aspera, is the part that the pectineus inserts on. So we changed its name. There's the logic. I'm not defending it. I'm just stating facts here, guys. Pectineal line of the femur. No. And finally, we get an illustration of medial rotation. So to see how this is going, I'm going to twist the bone around just a little bit so we can get a look. So again, when the muscle lights up, that's when the muscle is shortening. And we see that as it pulls, it's pulling the bone to rotate in a medial direction. Let's take a look from the front. And we'll take a look at the entire leg and see what's going on. All right, pectineus. Good stuff. And lastly, we have gracilis. Gracilis, the fifth adductor muscle, also has a claim to fame. It is the most medial muscle of the thigh, the most medial. If you imagine your thigh, like you look down at your thigh, you cut it off like a tree, and then kind of imagine a clock face over the top of it. Gracilis passes directly at 9 o'clock on the clock on your right thigh, 9 o'clock or 3 o'clock. It sits exactly on the medial aspect. It's right down the central midline. Gracilis begins at the inferior ramus of the pubis, insertion, pes anserinus, which is on the tibia. So here we have another distinct feature, the only adductor that crosses the knee, gracilis. So as with all of the other adductors, it gets the same three adductor actions: adduction, flexion of the hip, and medial rotation of the hip. But because this muscle also crosses the knee, we get another pair of actions. Number one is knee flexion. It bends the knee. Second is medial rotation of the flexed knee, meaning once the knee is bent, now the knee will medially rotate. So pulling up our thigh again, there is gracilis. You see it is the most medial muscle of the thigh, starting on the pubic bone up at the top, sliding down, it inserts at the pes anserinus. So guys, I know we're still not fully complete with this spot, but I want to share something with you guys. In my experience as a kinesiology teacher, we've already touched on pes anserinus once. We met it last week with sartorius. Remember, sartorius inserts at pes anserinus. Now we have a second muscle inserting at pes anserinus. We've also met a third muscle that inserts at the pes anserinus. Who can tell me what it is?
Semitendinosus.
Very good. Semitendinosus. So guys, here is some free advice from me to you. Anytime multiple muscles are inserting at the exact same point on a bone, you have got to know all of those. That is begging to be a test question. Which of the following muscles does not insert at pes anserinus? A, B, C, D. Which of the following muscles all share an attachment? And there's a whole bunch of mixed up options and you have to pick the right three. So guys, pes anserinus. Three muscles that all insert there.
gracilis,
Semitendinosus, sartorius, gracilis. I am telling you right now, that is absolutely something you will need to know. If not for my test, for somewhere on the MBLEX, something. Anytime multiple muscles share an insertion point, that's going to be a test question. Because we've seen this again, my friends who were in uppers with me last quarter. You guys remember the coracoid process of the scapula? And there were like three muscles that all started right there, and you had to know all of them. So just wanting to bring your attention, make sure that that's somewhere in your notes, that we know off the top of our heads, all three muscles that insert at pes anserinus. So let's go one deeper. There are the three muscles back to back to back. Right in front, you have sartorius. Next, you have gracilis. Next, you will have semitendinosus. I do not think you'll need to worry about the order that they insert. You will just need to know that these specific three muscles insert at the same spot. So there you can see those 3 marks there, there, and there. Markings on the bone that mark where muscles insert. And just a side note, guys, you've seen these skeletons before, like in classrooms and stuff. Red marks indicate origins, blue marks indicate insertions. And then on the skeleton models in a classroom, if you look really closely, they're all numbered. There's a book that comes with it. So the numbers, when they match up, like 104 red, 104 blue, that's the same muscle. So you're seeing that muscle's origin and insertion. So what you are seeing here on this tibia, those 3 marks, you're seeing the 3 insertions back to back. And again, I'm not praising their accuracy. I'm just letting you know the old guys that named all this stuff, they smoked a lot of opium back in the day. So it's kind of like seeing shapes in clouds, right? They were on a lot of intoxicants and they're like, whoa, that kind of looks like the foot of a goose. So I'm going to name that after the foot of a goose. So they named it after the foot of a goose. That is what pes anserinus means. It literally means the goose-footed attachment site. So you've got 3 separate muscles. And if we use our imagination, you see how it kind of resembles the little footprint of a goose. If you see it, awesome. If you don't see it, don't worry. They were on a lot of drugs. You're probably just too sober. But that's what the word pes anserinus means. Literally is the goose-footed attachment site. So we've got all 5 adductors. Of these 5 adductors that we have talked about, I'm going to change color here. All 5 had the same basic actions. Those were hip flexion, hip adduction, which is inferred because they're all called adductors, and medial rotation. They all had those same actions. Now, 2 of them had extra actions that were added. Adductor magnus got plus hip extension. And the only one that crossed the knee was gracilis. So gracilis also got knee flexion and knee. Otherwise, they all share these same common actions. Cool stuff, fun stuff. Overwhelming. Good stuff. Not too overwhelming, I hope. All right. So how are we feeling? Any questions offhand? All right, well, we're only halfway through our lecture. So we've covered all the real material for today, right? We've covered the 5 adductors, we've covered origin, insertion, action. However, now we get to scroll up to the top and see if there was anything extra. Since we're talking with adductors, groin pulls. Anyone ever pulled a groin muscle? Boo, boo. I don't recommend it. It's not fun. Don't do it. But in the event that you pull your groin muscle, most of the time, the specific muscle that was pulled is going to be pectineus. Which means that to work on a groin pull, So there is pectineus. So we can imagine kind of where this muscle is going to be. Where are we going to have to be working on our client? You're going to have to be working right up into the inguinal region, right? Right up against the inguinal ligament, because that is where you'll find the pubic bone running right along the inguinal ligament. You're going to have to be working in the inguinal triangle. So being very, very cautious of the artery, the nerve, the vein that all run through there, while still working on this muscle, right? You're still having to strip the muscle. You're still having to maybe do a pin and stretch where you put pressure on that spot with the heel of your hand. You grab their knee, you put pressure and you abduct the thigh. The pin and stretch. Put pressure on the muscle as you lengthen it. It's, just being very, very careful, particularly with our draping. So one technique that I've used on clients before, and I'm sure you guys have done something similar to this, maybe working in the axillary region on clients, but I will generally do something with females where I'll drape them properly. So then when I'm trying to work into the axillary area, I will have the female client reach around, grab her breast tissue and pull it towards the midline, which gives me, number one, a physical boundary. So I don't bump the breast tissue, I bump her hand, but that also pulls all that extra tissue out of my way, opening up the space that I need to work on. I will have dudes do the same thing. So I drape them properly, right? Undrape the thigh so that I can work on the thigh and hip. I will have the dude reach down and pull to one side so that if I bump anything, I'm bumping the back of his hand and not anything sensitive. And just having that stuff pulled out of the way opens up the space that I'm trying to work on. And I know, like, trigger warning, guys, here's some CG nudity, but when we add skin onto this guy, you can see really where we're working. We're really going to be focused. My square was a little bit off, but you see what I mean. Right on that front hip area. All right. If we're feeling good in the neighborhood.
I have a question slash thing I wanted to ask. If someone has an abundantly tight adductor magnus, won't it sometimes present with the same symptomology of a deep vein thrombosis? Because you can, like, I've seen it sometimes where it like is pressing on the femoral artery and causing like that deep throbbing pain that we're always told to look out for DVTs.
Yeah, but if deep vein thrombosis was a concern, I'm sending them to a specialist to get a vein scan. Yeah, if DVT is a concern, I don't want to do much, especially deep work on the thigh, because if they do have a blood clot, the last thing I want to do is send it on its way. So I would usually send them to a vein specialist to get a scan. Those vein scans are really non-invasive. They can shine a light essentially, and it lights up the veins. If there's a clog, they can spot one. And then they deal with it however they deal with it. It's outside my scope. But yeah, adductor magnus, because of those little divots where you've seen on the bone where blood is passing through that muscle. Yeah. Yeah, Carrie, you're not wrong. All right, guys. So if we're feeling good, then you'll forgive me for quizzing you on how we're doing. So I'm going to ask you guys some questions, okay? Okay, it's going to be fun. It's going to be fine. All right. First things first. Name the endangerment site that we've discussed on the front of the thigh. What's it called?
Femoral triangle.
Femoral triangle. And the femoral triangle is bordered by which structures?
Inguinal ligament.
Sartorius.
And
Adductor longus.
adductor longus. Very good. Why is it an endangerment site? What I mean is, what's there? What structures of caution?
Femoral vein.
Femoral vein,
The femoral artery.
Sciatic nerve,
not sciatic nerve,
femoral nerve, sorry.
femoral nerve. Yep. Femoral artery, femoral nerve, femoral vein. What else?
Lymph nodes,
Lymph nodes. One more. The longest vein in the body.
the femoral artery,
The great saphenous vein.
Great saphenous vein. Yeah, we had already said femoral artery.
whoops,
That's okay. That's okay. Femoral vein, femoral artery, femoral nerve, all those inguinal lymph nodes, and the great saphenous vein, all of which pass very close to the surface, right near the front of the hip. All right. So next we start looking at the adductor group in general. What is our mnemonic device to remember the names of all of the adductor muscles?
Please bring me lunch, girl.
Please bring me lunch, girl. Good job.
Thanks.
So these muscles, they are
I know the G is gracilis.
gracilis. That's a good start.
Pectineus, pectineus,
Pectineus,
Adductor brevis.
adductor brevis,
Adductor longus,
and
Magnus.
last, magnus. Awesome. That looks really bad. There we go. Much better. All right. So of these muscles, which was the one that extends the hip? Sorry, I got like a
Magnus, adductor magnus,
adductor magnus. Very good. The only one that extends the hip, which is the only one that crosses the knee.
Gracilis.
Gracilis. So what two knee actions does it give us?
Knee flexion and medial rotation.
Excellent, excellent, excellent. Excellent. So all the other adductor muscles give me the same actions. What actions are those?
adduction,
Adduction,
Flex the hip.
flex,
Medial rotation of the hip.
and medial rotation. Very, very good. Very, very good. What is the common insertion for many of the adductor muscles? Many of the adductor muscles share a common insertion.
Medial lip of linea.
Medial lip of the linea aspera. Your muscles that say adductor in them will all insert along there. So pectineus gets its own insertion at the pectineal line. Gracilis, we know pes anserinus, it's one of the three at the goose foot. So that one gets a new one. Pectineus gets its own, but all the muscles that have adductor in their name will all insert at the medial lip of the linea aspera. So if we really, really think about it, we started out with 5 muscles, all with different origins, insertions, and actions. And what now do we really have to focus on learning? Origin. That's pretty much it, right? Because the insertions, we figured out how to group those together, and the actions, we figured out how to group those together. So I don't really have to memorize a whole lot. I really just have to memorize like 5 origins. Good stuff, guys. Good stuff. All right, so let me ask you just a couple of other questions then. Just kind of general kinesiology questions. So if we're saying adductor longus, for example, what would I do to lengthen adductor longus? What would I do to lengthen adductor longus?
Abduction of the hip,
And
extension of the hip,
and
lateral rotation of the hip,
excellent. Why?
because those are the antagonists to the actions that it has.
Yes. So all 3 of those actions, adduction, flexion, medial rotation, that's what the muscle does. So when we adduct, flex, and medially rotate the thigh, that muscle is shortening as much as it can. So to lengthen the muscle as much as we can, you want to do the opposite of every action that muscle does. You want to abduct and extend the hip and laterally rotate it. When you roll that leg out, swing it out to the side and pull it back as far as you can get it, that adductor longus is as long as it will get. From there, it can contract and shorten and then bring the leg back into medial rotation, adduction, and flexion. Good stuff. So what about gracilis? How would I lengthen gracilis? As much as I can.
Lateral rotation. Oh, extension. And one more.
So with
Abduction.
Oh, it crosses the knee, so it
across
would.
the knee.
I
Yes,
don't-
so with gracilis, so follow me here. With gracilis, it does all of those actions and it does all of those actions. So I need to go one by one,
Extends the
do
knee.
the opposite action.
Extend the knee, then
Extend the knee.
lateral rotation.
Yeah, you can't really laterally rotate the knee.
I
so
don't
that-
know. I don't know. That's all I
can't do
know.
that
I'm
one.
sorry.
Can't do this one. We can't do lateral rotation of a flex knee. It doesn't really work out well, but we need to abduct our hip. We need to extend the hip. We need to laterally rotate the hip, and we need to make sure that the knee is fully extended. If we can do that, gracilis is as long as it will get. Do you guys see what we're doing here? To lengthen the muscle, you just look at every single action it does, and you do the opposite. Cool, cool, cool. Cool, cool. All right. So next week, remember, we do not have lab next week. I'm out of town. We're doing our online lecture, but we're just going to put the lab off until the week following. So next week, I will see you here. But next week, we will not meet in class. I will see you this coming up Thursday, though. Like Thursday, this one, the 3rd. Yes, we are in class on the 3rd. I'll see you then. When you guys come to class after our little break, these are the 5 muscle cards that are going to be due. Magnus, longus, brevis, gracilis, pectineus. So the muscle cards that I want to see coming up this week when you come to class are what? Quads and sartorius. Right? The vastus medialis, sartorius, rec fem, those guys. Cool. All right. Any other questions? Anything else we want to talk about? Since I'm here. All right. Well, when you guys talk all at once, I can't understand a word you're saying.
I was just asking if in the chat if anyone wanted to do a study group.